Hello, and welcome to the Rest, Repair, Recover podcast. I'm Suzy Bolt. This is a space for anyone who's navigating chronic illness. We are here to share real stories, helpful insights, and honest conversations about what it really takes to help yourself heal a tiny bit every day. So whether you're in bed listening, you're on a gentle walk, or you're just needing some company as you go about your day, I'm so glad that you're here. Welcome to a conversation that I am going to be having with Kevin Leivers from The Naked Pharmacy. Now, I am super happy to be sitting here at a table in person with Kevin because Kevin brings a wealth of information to our discussion. So Kevin's company, The Naked Pharmacy, specialize in supplements and also helping people understand which supplements to take when. But Kevin also has an incredible background of working as a pharmacist, so pharmaceutical knowledge to die for. The very first topic that we are going to tackle is the topic of sleep. So Kevin, hi.
Hi, nice to see you again.
So good to have you here. So let's talk, Kevin. First of all, let's say I am patient A and I've been having really disrupted sleep. I've got a chronic illness going on. Maybe I'm having a really bad reaction to something like the COVID virus and my nervous system is really dysregulated and I'm just not getting the sleep that I need. I'm going to go to the doctor and they will potentially prescribe me what? So what is the first port of call that people often go to?
Yeah, so there are a series of drugs and the GP will go through a process. So the first line, second line, according to their guidelines.
Right.
So GPs kind of have to follow standard guidelines across the NHS. So we talked about the drug that you had in your experience with Zopiclone.
Yeah.
The so-called Z drugs, which affect GABA, and GABA affects sleep. So obviously, it's a little bit trial and error where, in terms of sleep, as you found the Zopiclone didn't work, and I've heard that before.
Yeah.
And I've had people that in my network, in my sphere, that have gone through the whole range. So you'll start with the Zopiclone, and then if that doesn't work, then they'll move on to things that are called Benzodiazepines, which are more old-fashioned drugs that were used to calm people if they're having anxiety, nervousness, etc. And they would use that at various doses to basically knock people out. It's quite a crude drug, the benzodiazepine. So, I mean, in the old days, they were called, Mogadon and things like that.
Right.
Now they have to use generic names like nitrazepam and temazepam.
Okay.
So anything
Does Valium come in that kind of family?
Exactly.
Okay.
Exactly.
Great.
So they'll vary according to what the protocols are within their area, and they'll vary the dose. So hopefully they'll start low and then sort of build up according to. So benzodiazepines are quite a crude drug. So Zopiclone is quite a more new generation drug.
Okay.
And when I say crude, it's kind of like quite a heavy blanket, if you like, to your nervous system, which is why one of the issues with benzodiazepines like temazepam and nitrazepam is that you get this hangover effect the next day. So you get this brain fog hangover effect, and you certainly don't feel the level of anxiety that you perhaps had before. And I think anxiety is a big part of sleep, because obviously if we're programmed that we've got to get 7 or 8 hours, and if we don't get our 7 or 8 hours, then suddenly there's an anxiety about that feeds in, and actually it's a bit of a rolling cycle. It makes things worse. So they can be effective, and in the case of people that I know, they didn't work either, and so they sort of moved on to antihistamines. These are called the H1 receptor blockers. So typically they might be used at higher doses for allergies and hay fever and rashes and stuff like that. So at lower doses they're used to try and trigger that sleep pattern. The issue for these generally prescribed medication is that I think they are a short to medium term fix.
Yes.
And but at the same time, I don't think people should be feeling guilty about that. It's really about risk and benefit. And I think initially, particularly when you have a condition that suddenly arrives like this, so some people's conditions happen slowly. So it's a general creep of a worsening of their sleep cycle and what have you. Whereas with you, I think it was quite sudden. Post
literally.
COVID.
I mean, it was a combination of being in the COVID pandemic, locked down with the virus that people were dying from, and my nervous system just went nuts.
And absolutely, you need to catch it as soon as possible.
Yeah.
So in the early stages, I think it is a useful option to try these prescription drugs. And the problem is then it's a sort of heart sink moment as you go through the cycle.
It's not working.
That's not working.
Yeah.
And the same thing happens with my friend.
Yeah.
Went through the whole kind of cycle of this. Next phase after antihistamines are low dose antidepressants. So SSRIs we call them. So Prozac type antidepressants. Again, a big class of drugs, lots of different types. Generally, if it says teen on the end, fluoxetine, whatever it is of that type of class. And so there is an element of that. Maybe it's the way it affects the nervous system, so that it allows you to kind of sleep better because you're not so worried about it and your mood's not so affected by it.
Right.
And actually, in this case, he was on a full dose of fluoxetine, and that really worked for him. So he stayed on that drug for quite some time. So the problem is obviously if you go through that cycle and you haven't found anything that works beyond that. So the question is, where do you go next? And I think this is where we have to remember these drugs are short to medium term, and that they're not necessarily the best for good quality sleep in terms of REM sleep. So if you look at the data on these drugs, they're reducing REM sleep, and we know REM sleep is where the body really starts to restore itself.
The sort of magic happens.
And in your case, I suspect that you've got probably one or two organs or systems that are failing.
Yes.
And they are speaking to your brain a lot, basically, and which is why you're waking up at
it was constant waking.
Yeah,
constant.
It's like, hello, I'm here.
Yeah,
I need some help here.
Yeah.
So I think it's really important with any prescribed drug that you run parallel support systems.
Yes.
So your sleep hygiene, if you open the fridge door at 2 a.m, you're waking up, you're just, you're sleepy, groggy. I think I'm just going to get a drink. I'll make a drink, a milky drink, or whatever it is. That's going to reduce your sleep hormone level by about 40%. Just the very
light,
the fluorescent light that's coming through, just by that few seconds. And then obviously you've got a 40% reduction in the sleep hormone that you absolutely need, the melatonin.
Right.
And so I think sleep hygiene should not be underestimated.
Yeah.
And a lot of this is also trial and error, because I think that we've lost the art of working with our own body, because for generations, at least 40, 50 years, I think we've so deferred to the GP and the medical system and the prescription drugs, and because that's what they want us to know.
Right.
That this is the solution to your problem.
Yeah.
And absolutely, if you're in an acute situation,
take the pill.
Take the pill, yeah. Or the extreme circumstances, you might have to have a surgical intervention or whatever it is. And absolutely, those prescribed drugs in acute situations are necessary and required. Yeah. But chronic conditions like this, you have to kind of run different systems alongside, and you have to then develop those to a point where it works for you.
Yes.
So what works for you? Sleep hygiene, absolutely. Light, eye masks.
Yeah.
So those triggers, noise, blackout blinds, the temperature of your room, the comfort of your bed and stuff, what you're drinking within the last few hours before you go to bed. So, don't underestimate the impact of caffeine with a half-life of around 8 hours. So that means the time it takes for half of the level of that caffeine to obviously half. So if you're having caffeine at 1 o'clock, it's 9 o'clock, and you still got half that level of caffeine in your system,
right? Which
is a stimulant. So, and again, people just assume, I think, because we've lost that skill of actually. I suppose in the past we never had to look at ingredients lists because it was so close to nature from the farm and stuff, and our food and drink was very simple. But now it's something very complicated. Even the supplements that you're taking is very complicated.
Yes.
So I think one of the things that we do at the Naked Pharmacy is that we try to teach people, we empower them with information so that they can make effective, informed choices, empowered choices. So in terms of what to do alongside it, sleep hygiene, your food and your drink, do not underestimate the power of food and drink to both cause disease or cure disease.
Yeah.
And I, as a pharmacist, apparently I'm not allowed to say that, food causes or cures disease. But actually, if you look at sugar,
Right.
sugar causes diabetes if you have too much of it. It's very obvious. Hippocrates, let food be thy medicine. Totally
Yes.
with the program. So the fact that actually we're not allowed to say that is rubbish. And I think that people need to understand that what they're taking in on a regular basis is impactful on many, many different levels. And so, if you're taking a box of something and you've got an ingredients list, then investigate it. If you've got a bottle of supplement, I see so many of these protein powders and stuff, and there's an assumption that it's pure protein, but it's not.
Right, no.
Often they're mixed with maltodextrin. What's maltodextrin? It's milk sugar.
Right. So the thing that you're taking, thinking it's going to be helping you, is actually causing more problems elsewhere in the system.
And sugar is a driver of inflammation, and inflammation, long-term, uncontrolled, is a driver of disease. So, and that includes, chronic diseases like Alzheimer's, cardiovascular disease, blah, blah, blah. And so impact on every system of the body, including sleep, is fundamental. So sleep hygiene, fundamental. Food and drink, fundamental. Exercise, fundamental. Getting out in the morning light, impact. What happens in the morning has a kind of pivot effect to the evening. So your light in the morning will affect your cortisol, will affect the melatonin that you produce in the evening before you go to sleep, the natural sleep hormone. So getting out into fresh air in the daylight in the morning is fundamental. It's very simple.
So let's take patient A for an example. Patient A has been really unwell. Maybe they've had a diagnosis of long COVID or chronic fatigue. Their sleep is really disrupted. They can't exercise because they know that that's one of an exacerbators of the symptoms. And maybe they're staying in bed a really long time in the morning because their system doesn't want them to get up because they've had such a terrible night's sleep. So what would be the right way of helping that person to begin to change their kind of circadian rhythm to get this exposure to light, which we know is really fundamental for the production of melatonin? Can you get it from sitting in your bed and maybe being a little nearer the window? Do you have to be outside the house?
Ideally, fresh air is great.
Sure.
But if you can't, then you find ways to adapt. So, there are light boxes. Light boxes.
Right.
Which, I think it's a good solution, but simply opening the curtains and opening the windows.
Opening the window,
Getting fresh air, it's really important. So there are always ways around to adapt and stuff. So don't think you've got no option, because there absolutely are. Because
you can't exercise and you can't get up at 6 a.m. to watch sunrise.
Absolutely. So I think that's a really important influence in terms of sleep. And these things take practice, they take time.
Yes.
I think we were talking about breakfast this morning.
We were,
And, my brown breakfast that I used to have for a long, long time, it took 20 years for me to transition into having, green leafy salad.
Yeah, he has salad for breakfast, guys. I'm just saying this.
And vegetables for breakfast, absolutely. And because actually my body's telling me now. It was difficult at first, but now my body tells me. And I think this is the same with patterns and stuff. Once you start to transition, your body starts to speak to you. Well, this is good. I want more of this. But it takes some time and takes practice.
Well, a lot of it is about not wanting to push ourselves out of our comfort zone.
Yeah.
I don't want to change. I like eating my, whatever I eat, my cereal and my toast in the morning. Or I don't want to change. I don't want to get out of bed and sit in an armchair by the window with the window open because I'm really comfortable here. And actually, what we know is that when those little tiny pattern interrupts do become, even if you just give it a 7-day trial, you will begin to notice a difference of, I think my body's saying thank you. So maybe I'll give it another 7 days.
Experiment. Have some fun with it. It becomes quite heavy if you're so serious. If you're beating yourself up when you're not getting your 8 hours and stuff, or I'm not doing this, I'm not doing that. Actually, try to be, and it's a really difficult thing, be content with where you're at in your journey at this point in time. And that's really difficult when you're not well.
Really difficult.
The discontent and the internal struggle, anger, frustration, all that stuff is difficult to manage. But I think writing down that frustration, get it out of your system. I think that there's a, we underestimate again the toxicity of thoughts.
Yes.
And no point in fixing your body if your mind's kind of relaying the same thought patterns and belief patterns.
Yes.
So you have to, even though it's not there, you almost have to have the faith and believe that actually you are on the journey to wellness. You are doing the right things. And I think that reassurance, reaffirmation, fundamental to change.
Agreed.
Because otherwise whatever you do is not really going to have the impact. So if you want to get the best out of whether it's prescribed drugs or the natural holistic treatments, to get the best out of both, then the mindset change is really important. And those are the mindset changes that will drop your dose. Say if you're on an SSRI antidepressant, then actually that's going to drop your dose. And it applies to a lot of things. You can probably get better effects out of a lower dose if you've got a good positive mindset and stuff. Yeah.
If you allow the possibility for change to happen.
And obviously that needs to be done in conjunction with the GP because you need consistency of health for him or her to make that change in a dose, because that it's a partnership, right? It should be a collaborative partnership between you and your GP and your doctor.
Not always, as we know.
And actually we have the freedom to choose these days as well.
Do.
So to move.
Yeah.
So coming into supplements.
Yeah.
In terms of my experience of what works, and I also looked at it from a chronic point of view. I understand there's a cost implication to supplements that needs to be factored in. So I try to make things simple and cheap and fast.
Great. So people aren't having to think, I need to try 7 different things at the same time.
Yeah, and please don't.
No.
Because as we discussed before, how are you going to figure out what's working?
Right. You're stuck on all 7.
Yeah. So, and a number of times that the pharmacists at the Naked Pharmacy, and we provide that free service for a reason, is that we're often peeling back, 12, 13, 14 supplements and saying, actually, start with one, let's figure out what your trigger points are, what your symptoms are, and let's see if we can track improvements. And if a supplement's not improving your symptoms, and that might even just be a diary entry. Today my symptoms are 10, but since I've started taking my magnesium, my sleep and my nervous system is a 3, and that's consistently like that. So therefore, it's a significant difference. Or I stayed at a 10, and it doesn't seem to be shifting. So if you're doing that for a month, then I think normally the supplements are a month supply, right?
Yes. So you'll know.
Yeah. So if you're still a 10 or a 9 a month later, then really you've got the wrong supplement.
Yeah.
So it's a very common sense approach, but at least you're quantifying an improvement. And I see so many people that, I'm taking all these 12 supplements and I think I feel better, but actually probably there's overlap on many of those supplements that actually might be causing more harm than good. So,
well, I was just going to say, is taking 12 supplements something that the body can even manage?
Well, it can, but actually, if you're taking a multi with a zinc in there, for instance, and then you take another supplement which got zinc in,
right?
Then if you go over the recommended daily dose, the benefits of the zinc starts to reverse.
Right.
So actually, you're doing more harm than good in that situation, and you're spending too much. Actually. And these multis with 20, 30 ingredients, then there's no evidence base for most of those ingredients. Probably 1 or 2 of those are filling an important gap. Vitamin D, magnesium, those are fundamentals. The deficiency rate is over 50% of the population, and so it's a no-brainer in terms of vitamin D, magnesium. No-brainers. Talking about magnesium, lots of different forms. I've seen lots of tables around, picolinate, citrate, oxide, and I've seen tables outlining different symptoms for different magnesiums, and there's no evidence base for that.
Okay.
So actually, I believe it's a choice between whether it's synthetic or whether it's natural.
Okay.
So that's my reference point, and it's a common sense thing that actually, our magnesium comes from seawater. It's sustainable. It's recyclable. The body recognises it from its natural source, and that's the hydroxide generally from seawater, and it's effective and it works quickly and it's cheap, relatively cheap. So
what other sorts of magnesiums? Where else will people get it from? Because yours sounds really nice and organic and natural, but are there other non-natural?
Loads.
Okay.
And I would say 99% of the supplements out there are synthetic. So they're called natural. They're allowed to be called natural under UK, European law, but actually they're made synthetically. So when they're made synthetically, they need synthetic solvents. So those are the things that dissolve the solids to enable them to react. They often take 5, 6, 7 chemical stages. So all the chemicals involved in that creates environmental. But for me, more importantly, or equally importantly, is there are residues of those chemical stages in the final product. Right. In European law and UK law, we are allowed sometimes up to 2% of those residues with a synthetic supplement. So whether a supplement is synthetic or natural, truly natural, is really important, because if you're signing up to a synthetic, you have to be asking that question: what's the solvent? What's the percentage solvent residue?
Right.
Because that might be a source of toxicity that you're consuming on a regular basis that might be causing the problem that you've got in the first place, or exacerbating. So,
yes.
So informed choice, and vitamin C, cheap as chips. You can make it synthetically, 5, 6 days conversion from corn, lots of solvents in the process, and probably a solvent residue, but you've got to ask the question, what is it and what's the residue? Have you tested for it? Should be on the test certificate, but they don't like saying that.
No.
Or some people, if you ask the question, they're going to be scrambling to find the information. It's the first thing we go to in terms of, even from a natural source, CO2, carbon dioxide extract, water, or grain alcohol, because you can evaporate grain alcohol off to a very, very tiny residue. So that's all we do, even though it's from a natural source. So the C, will come from acerola cherry, or come from Indian gooseberry. Yeah. So we get ours from a natural source, but even the way we extract it is really important, because even with natural sources. So these are the questions we have to learn to ask, or equally you could email us in or call us, and we will review whatever you've got, and we're happy to do that even if we don't sell it. So just like we review conventional medication as well, because people want to know, can I take this with this, and is it safe to do so? So magnesium is effective for sleep. It's a great resetter. You should know within a few days, particularly if you're restless, and if you wake up at 2 a.m. and there's that restlessness about it, then you can take a magnesium at 2 a.m. and it can reset you and resettle you.
Oh, interesting.
So
I actually used some magnesium for the first time last night in a long time, because I've been noticing I've been waking up quite early and feeling quite hungover for a while. And I know that there's not much else that I'm taking, because I've tried not taking it. I'm just taking HRT. And I've tried not taking each of the pieces. So I know that, the feeling is still there, even if I don't take something. And I had some magnesium butter that I bought ages ago that I think I'd tried in a state of real sleep disruption, and I hadn't noticed the difference that I'd wanted. So I'd left it. And I tried it again last night, I think because I thought, I'm going to come and talk to Kevin tomorrow. And I'm sure we're going to talk about magnesium. And I put some on my skin, and I woke up this morning without the hangover feeling.
Wow.
And went, oh my goodness, it's been sitting next to my bed for months. And I've not used it, but it really does have an effect. And I think, And
the skin is a great way of absorbing.
Right.
So some people say they can't take magnesium internally, in which case then have an Epsom salt bath.
Right. Yeah.
Really, you can get, buckets of Epsom salts for
just soaking it.
And it's really cheap. And it lasts forever. You'll have obviously you've got the butter,
some kind of body butter.
So again, it's absorbing through the skin. It doesn't quite absorb the same quantity. So internally, I think is best. But look, it's a bit like going into the seawater. It's, very salty, but salt water conducts electricity, and so if you think about your body has all these wires internally. And if you put a magnetic sensor near any electrical cable, you'll pick up a magnetic signal. And we have the same.
Right.
So if your system's going a bit haywire, the great thing is to get into a salt bath,
Right.
Because it just helps to kind of settle.
It sort of releases the
I've
charge.
never seen anybody do a kind of like a body scan before and after magnetic resonance, whatever it is. But I bet my bottom dollar that those pulsars around the body will reset that, and then will help to calm the internal nervous system. So we are, again, the science is not really caught up yet, but it's starting to. We are an energetic body. So, and there's some data in terms of the magnetic signal, energetic signel from the heart is over 100 feet. It's incredible.
What?
Yeah. So
I did not know that.
Yeah. So there's a company called Heart Math and stuff like that.
Yes, I've
really
heard about
useful
that.
data.
Yeah. So that takes us into the realm of earthing.
Yes,
and those earthing sheets that people talk about, and walking barefoot on the ground, and all of those things to kind of discharge that energy.
Yeah, and obviously yoga and breathing, fundamental.
Obviously,
there's if you look into Iyengar's book, Light on Yoga, there's a whole section on medical yoga, and so one of the things for resetting heart rate, because the heart rate is connected to the lungs and the rhythm of the heart, and the lungs are very much in tune. So there's a pressure point here. So there's a position that pushes your chin into that notch there.
It's a bandha, a lock.
Yeah, bandha, a lock. So, different nasal breathing and all that sort of stuff. So I think practice with it. Some people have got watches so they can check their kind of heart rate and what have you. Play with it. Check it out. Start to reinvigorate, reconnect with your body, because as we talked about earlier, actually what you take in, it sometimes, we're talking about various prescribed medication as well as supplements. The data is not there. So actually, how do you figure out whether that's safe and effective for you?
Be your own barometer.
Yeah, be your own checkpoint and stuff like that, and tune in. Use your intuition. And I think the more we develop that, the better we will be at choosing the right solutions to the problems that you have, and actually anticipating the problems before they occur. Prevention is better than cure. So magnesium, definitely 100%. Melatonin, I call it natural because it's a natural sleep hormone.
Right.
You can get it prescribed in this country.
You can get it prescribed, but you can't, like you can in America, walk into any pharmacy and pick it off the shelf. So tell me why that is the case here.
Because our regulatory body believes that because it's a hormone, the potential for interaction with other medication and disruption of other hormone systems is there, and therefore they want to control it. But I think this is where sometimes you have to kind of look wider. So if you look, there's been a review of supplements on the US market as well as elsewhere, and when they tested the melatonin in those supplements, the variance is huge.
Yes, I'm sure.
And so a lot. And this is part of the issue with chemical supplements, so synthetic supplements, is that they're made in a way that the chemical, I would more align it to a chemical industry rather than pharmaceutical industry. There are some pharmaceutical companies that are making vitamins. It's like vitamin A is made by BASF, and their quality and the strength is spot on.
Oh, wow, okay.
Because if they're made with pharmaceutical standards, the pharmaceutical standards in terms of manufacturing,
they've got a lot of rigor around
There's
them.
a lot of rigor around it, and that's what you want. And unfortunately, that's often not applied to synthetic supplements. So I've done an independent review of vitamin A supplements provided by wholesalers in Europe.
Oh, gosh.
And found that A, it wasn't the right vitamin A, and B, it wasn't, the strength was something like 100%. Yeah, it was like pretty much half what I would expect it to be.
Interesting.
And when I asked for the data back from the supplier, they ghosted me. And so it was very interesting and an eye-opener for me. And I think it's driven me to go down the more natural route with supplements, because often, unless I can fly to China or to India and audit those facilities and say, well, okay, how are you making these? What's the solvents that you're using? How are you testing them? Because I asked for test certificates, they wouldn't supply them to me. And we did our independent testing here. And actually, one of the things that we do is we independent test in the UK as well as the test certificates that are being supplied, because I audit all our factories and suppliers, but at the same time, there are one or two that we have to just double check just to make sure. Saffron, for instance, gets adulterated quite a lot because it's so expensive.
Right.
So you have to make sure that it's not suddenly gone through a provider that's taken half and then mixed it with something else. So that's really important.
So on melatonin then, this interests me, knowing that in the UK particularly, and I know not all of our watchers are in the UK, but in the UK, we can't get it. And so, like me, I'm buying from Germany at the moment.
Yeah.
And I'm curious then to know, if I could get it prescribed by my doctor, is that actually going to be a very good quality level? Because it's coming through. Oh, right.
Much
so
better,
great.
much more consistent, much safer, because
Interesting.
when you're making things chemically, there are chemical side products from a synthesis that needs to be tested for and controlled.
Great.
And taken out.
Yeah.
And that's what pharmaceutical processing does, and that's what food processing sometimes doesn't do. So I think in this case, I actually agree with the prescription status of melatonin.
Okay.
And actually, we brought on 2 pharmacist prescribers at the Naked Pharmacy so that you can sort of go through that system.
People can get it from you?
Yes, exactly.
Now we know. So let's just recap for a moment. We've talked about many, many things around sleep. And obviously we've explored the drugs that we could buy, or not buy, get from the doctor. We're looking at the other things that we can put in place to support that. We've talked about magnesium. We've explored melatonin. And the kind of sleep hygiene, definitely being aware of what we're feeding ourselves emotionally and mentally as we move towards that sleep place. But what other top tips have you got that you could say, try this as well? Because this is easy, has no harm to the body. What else would you recommend?
The one go-to is good quality herbs, 2 good quality herbs and loose leaf. So not a tea bag.
Okay.
Because often the dose is not correct and the quality is not correct.
So when you say herbs, what do you mean?
So herbs, loose herbs, so lavender flower.
Okay.
So if you go to Neil's Yard, for instance, they've got really good quality herbs. Some health food stores will have loose herbs as well. So you can tell. You can see by the appearance, the smell.
Yeah. They look a bit rustic, don't they?
Yeah, exactly. So if it looks old, then it's been there too long and it starts to lose a lot of its actives.
Okay.
So if they're well stored and well cleaned. So generally I find that from Neil's Yard really good. So lavender herb as a tea.
Okay.
Literally a lot. Like 3 tablespoons full into a pot.
Wow.
Passiflora, same. So passion flower.
Yes. Yeah.
It's a herb, so it's above ground parts and stuff. So not just the flower.
Yeah.
And again, 2-3 tablespoons full in a tea. So a lot.
Yeah.
So if you think about how much ground herb you get in a tea bag, so the quantity is really important. Hot water, steep it 5 minutes, and then sip the tea.
And I guess you're going to you're going to be putting this into your system as you move towards sleep.
Yeah.
So don't just try and have 1 cup of it as you're sitting in bed. You're probably going to be trying to bring it up into your kind of consumption a few hours before. Yeah. Okay, great. What about, so just to finish with, things like chamomile and valerian? Commonly told to be helpful for sleep, but
chamomile definitely, it's got a digestive element to it as well. So if you're getting issues with digestion at night in particular, then that's a great one to use. Again, good quality, loose herb, not tea bag.
Loose herb, not tea bag. So just so you know, when he came this morning to have a chat before we came in here, cup of Earl Grey tea, took it out the tea bag. Microplastics. Just know that. Okay.
Important as well, I think. It's becoming a big topic.
Yeah.
So valerian, interesting one. It's a nervine, so it's very much affecting the nervous system. So if you've got a nervous system element to your sleep where you're really anxious, then
so
again,
that's a good one to explore.
It's a good one. A little bit difficult to have as a tea because of the taste and the smell. So that might be a little bit more challenging.
Yeah, okay. But worth exploring.
Yes.
Okay, great.
Yeah.
So hopefully we've covered enough topics there to at least set you out on a little bit of a journey. I think it's important to not rule out the pharmaceutical options. And, Kevin has brilliantly talked us through those, as well as supporting yourself with all of the other things that you can do just to help. And I would say one of the things that I've kind of talked about the most is our response to not getting the sleep that we want, we really do need to work to not panic about it. At some point it will change, and that piece is probably also just as important as anything else that you do. So when you're lying in bed awake at night, try to perhaps put on a sleep story or a gentle yoga nidra or something calming, so that you're not lying there obsessing about the lack of sleep, because that in itself becomes a big part of the problem. So guys, go away and play with things, come back and let us know how you're getting on.
Thanks so much for listening to the Rest, Repair, Recover podcast. If this episode brought you comfort, insight, or even a little spark of hope, I'd love it if you left a review. It really helps more people find this kind of much-needed support. And if you know someone that needs to hear this too, please share it with them. I'm sending love, as always. Look after yourselves.